children in general. Laurie, thanks so very much for continuing to stay on the line with us. My next question was really about, what the situation of children was before, and I know you focus primarily on the Western Cape. So let's talk about what the situation was before COVID-19 pandemic. I suppose for one to truly appreciate how difficult things are right now and how bad things are for children at the moment, one does need to take a step back and look at how things were before. And it wasn't necessarily a rosy picture though before, was it? But let's talk about that.
Yeah, so I think it's really important to understand just how vulnerable children were prior to the pandemic. If we look at the national figures, 60% or close to 60% of children in the country were living below the poverty line in households with a per capita income of less than 1,183 Rand per month. 1 in 4 children were stunted, and stunting is a sign of chronic long-term malnutrition where children are not simply short for age. The malnutrition has also stunted their brain development with these very long-term effects on education and livelihoods. So we had a serious problem way before COVID-19. And we also know that South Africa is one of the most unequal countries in the world. So the ways in which the epidemic or the pandemic has been felt in this country has run along those same fault lines and deepened them further. We see that probably most clearly if you're looking at education, where those children attending quintile 5 schools that are relatively well off had the resources not only to be able to put social distancing measures in place within classrooms and within the schools, and not only did they have access to water and sanitation and all those resources, they also, those same children had the connectivity to be able to continue with online learning throughout the pandemic last year. So the disruptions that they felt were on a very different level to what was felt by most children in the country, where the effects on education have been profound. We're looking at what's estimated to be children in primary school losing a full year's worth of learning. At a time when you're really building the foundation for future education, and where those disruptions are most keenly felt. So we really are also needing to address these deep divides within our society.
Yeah, I want to talk also to about the long-term effects. I mean, in your report, you do mention that children may have to, sort of carry and grow with the effects of COVID-19. Let's talk about that. Are we at this point looking at a possibility of a traumatized generation, or is there some positivity, perhaps some behavioral positivity, perhaps that these children may grow up to have and gravitate towards later on in life? I mean, generally in every era there is some sort of trauma that children have to deal with that kind of takes them to their adulthood, and I wonder if this may be one of those traumas for the current generation of learners.
I think it's very difficult to recover from trauma without support. So I think one of the things that the set of advocacy briefs is calling for is for government and civil society to put support systems in place. So, for example, when adults are admitted into hospital with COVID-19, are we asking questions about where are the children? Are there children left at home who may be in need of food or care and protection? Are we thinking about how to use platforms, every single point of contact that we have with children and families, to put support systems in place, to identify those children who are struggling, whether that's in terms of material needs, so access to social assistance and food relief, that's very, very basic support, but also there's a need to put in place support to address both the trauma and grief that children and families are carrying. And we know that child and adolescent mental health services in South Africa are very, very thinly spread and really concentrated in urban centres such as Cape Town and Gauteng, and not really accessible elsewhere in the country. So how do we start to build the capacity of teachers, ECD practitioners, health workers, and members of the community so that they're able to step in and to help children cope with these significant disruptions and traumas.
Yeah, Laurie, it's been a pleasure talking to you. Thank you very much for that information, and thanks very much for that extensive report that you've done on the state of our children in the country. Thanks very much.
It's a pleasure.